have an announcement to make.
Oh, wow.
Just kidding. I'm not pregnant right now, but I'm getting closer to being ready, I feel like. I've been seeing babies, getting baby hungry, and seeing all of this food up here, Allie, makes me even more ready to get. So this makes me want to get pregnant right now. Is this what I need to eat?
Surprise, yes, no.
Oh.
So one of the things is they've done a lot of research, and trans fat significantly decreases your risk, or increases your risk for infertility.
So sad.
I know.
What?
Trans fats, you find them in a lot of packaged cookies and brownies and frosting and margarine. And so you've really got to read your food labels.
I'm never getting pregnant.
Okay, so there happens to be like 7 million people that are struggling with infertility. And come to find out, there's things that you can do, right, in your diet to kind of help with the problem.
Yes, definitely. And I think we all know somebody that struggled with this or has had to deal with this. And really, one of the biggest things to do is, if you're overweight or obese, losing weight. And this can sound like a really daunting task for a lot of people because they think they have to lose a lot. But really, just 5% of weight loss can be enough to boost your chances and increase your risk of getting pregnant.
That actually increases your ability to get pregnant by losing the weight. Because I always think, I'm just going to get pregnant. Why am I trying to lose weight to then get pregnant? But that will help you get pregnant?
It really does, because being overweight or obese can throw your hormones off. So losing 5%. So if you're 200 pounds, that's losing 10 pounds. Can make a big difference.
Well, I feel like cutting out the Chips Ahoy in my life actually would help. This is great that they correlate together.
You cut out your trans fats, help you lose weight.
Okay, well, what are things that you should be eating then?
So one of the things actually is you do want to cut back on trans fats, but you don't want to cut back on total fat. You actually want to increase the amount of monounsaturated fats in your diet. So doing things like olive oil or avocados, incorporating more nuts and seeds. So like hazelnuts are a great source, pistachios, almonds, peanuts.
So Nutella.
No,
not
Chelsea's like, something, please.
I'm like, what in my pantry right now could I still be eating?
Oh my gosh.
Okay, well, what about if you're a vegetarian? How does that affect
More
getting
power
pregnant?
to you, because high iron diets actually can promote fertility. But the thing is, it's not, traditionally speaking, we think of iron coming from animal sources because they're so high in iron, but it's actually cutting back on the iron from there and increasing plant sources of iron. So what that equates into is doing things like spinach or eggs or long grain rice, because those are going to give you more iron from those plant sources.
So let's say someone's trying to get pregnant in a couple months. Would they come and meet with you at LDS Hospital, since you're a nutritionist?
Definitely.
And dietitian, and you'd kind of make someone a menu of what they should be eating?
Could bring in your diet, and we can look exactly what you're doing and pinpoint things that you're doing incorrectly and say, okay, this would be a better substitution and a way to go.
That makes a lot of sense, actually. And I think that it's something that if you've been struggling with, getting pregnant, that's definitely something to consider. It's actually National Infertility Awareness Week coming up soon.
So this is
a perfect time to take a minute, kind of think about what changes you can make in your lifestyle and your diet.
This is a lot more cost-effective way than lots of the different infertility methods out there, especially, and I would think eating these healthy foods is actually going to make for a healthier pregnancy.
Definitely. You're prepping your body because you have to prepare your body to be pregnant and to carry this baby, and you want to be in optimal nutrition.
So, say somebody maybe wants to have a daughter. Is there certain foods they can eat? We're going to have to talk about that next time, because I may need to know that. But for now, I know I'm not trying to get pregnant this month.
Perfect.
So I think I'm going to
break those open
right now.
Break those open. If you guys want more information, you can go to ldshospital.org. Allie, thank you. Always such good information. We're in the kitchen making healthy omelets, it sounds like. So I think
those would help.
they'll pass.
Those
they've got eggs, and then you've got vitamin C in your peppers to boost the iron absorption.